Myofunctional therapy is a series of exercises that are led by a myofunctional therapist. Those exercises are predicated really on accomplishing three things through the efforts of our work together. One's going to be getting the patient to breathe through their nose versus their mouth. There's a host of things that can cause a child to have difficulty breathing through their nose, such as allergies, adenoids that are swollen, things of that nature. And so our goal is to identify the concerns that are causing a patient to breathe through their mouth rather than their nose and address those. The second thing we want to do is to make sure the patient can keep their lips together, which is the natural body's way of encouraging the bone and allowing it to grow on path. So when we alter the soft tissue and the way that we chew and eat and the way our lips come together, etc., from nasal breathing over to mouth breathing, we begin to change the influential factors that cause our jaws to grow on path with our genetic idea or genetic blueprint versus altering our genetic blueprint and getting a different outcome. So keeping our lips together is the second thing that we try to accomplish. And the third thing is going to be making sure the tongue is postured in the right place, which is in the roof of the mouth, and also it's functioning properly. One of the most common side effects that I see even in patients of an older age is a tongue thrust, and how they swallow and where they put their tongue when they're swallowing makes a dramatic impact on not only the teeth, but on the arch development. So when we put 4 pounds of pressure against our teeth, it can start to have negative side effects rather than putting all that pressure in the roof of the mouth and blossoming the upper arch. Our lower jaw will always respond to what our upper jaw typically does, and so we get a lot of kids with really soft chins. They have these, pulling eyes where they look like they're tired all the time. We see the really small nasal slits because they're mouth breathing versus nose breathing, and they're not expanding the nostrils. There's a host of different things visually we see that a lot of parents are not aware of that can tip you off that there's something developmentally occurring. But our goal comes back to always those three things. We've got to get the nose breathing accomplished, we've got to get the lips together, and we have to make sure the tongue is functioning and posturing correctly. Myofunctional therapy is aimed at exercises and efforts to do that. And here at Element 8, we also combine that with some simple appliances that encourage that change to get back on track, and also to make sure the jaws and the dentition are developing in a beautiful way, looking good and also functioning good.